report found that the health services were only responding to 1/3 of people who were needing mental health care. Did that figure surprise you in terms of just how widespread this issue is?
Well, I think from a rural perspective, we're fully aware of the lack of available services in rural areas. But I think it's also a fact that the services that we're receiving in rural areas really need to reflect the needs of the people and need to reflect an understanding of life and work in those rural communities. We can't just expect to implement a service that's been successful in a city perspective and expect people to successfully engage with that in a rural area as well. So even when people are able to seek services in rural areas, if they have a negative experience, that can certainly inhibit any future support seeking as well.
The report did recommend breaking down the state into regions. Are you convinced that that will lead to more local access to services?
I think it's a great first step, but I do think also that we need to take a real prevention focus here as well. And I noted that Commissioner Armitage really did highlight that need for prevention. So we're not only focusing on the need for crisis support, we're also very concerned about the need for that prevention and building capabilities and capacities within rural communities to be able to provide skills and resources to prevent people from experiencing poor mental health in the first place. I think we're very good at thinking of mental health responses in terms of supporting people at that crisis point. And that is extraordinarily important to be able to do that. But I think it's also important to take a step back and look at how we might prevent people from getting to a point where they require support services.
How important to you was the recommendation that the state switch from a police-led response to a paramedic-led response? Are you looking forward to seeing that switch happen?
Yeah, I think as long as we provide those paramedics with the support and the skills to be able to engage with people effectively, and again, you know, I'm going to kind of reiterate that need in rural areas to really understand the rural context and the stressors that people face in rural areas. To be able to provide them with adequate support, it's really important that people have those skills.